here's Ed Bernstein.
Well, as I promised, we're going to talk about concussions here with Dr. Branch and Dr. Pensivy. Dr. Branch, you specialize in what is the specialty called?
So the specialty is a neurological clinical specialist. As a doctor of physical therapy, we are pushing towards having better specialization within physical therapy specifically. So I pursued specifically neurological conditions, and what we'll talk about even further in depth is concussion, head injury, vestibular, quote unquote, that deals with dizziness, vertigo, more commonly heard from those terms, and how the brain, the inner ear, the spinal cord, how they all interact.
They're all connected.
All connected,
yeah.
Yep.
What is a concussion?
Concussion is, there's a lot of definitions, a lot of gray area that's going on right now, Ed. Concussion generally, we would say, is a form of brain injury. That's one of the things we want to make sure we're clarifying, is that this is brain injury. It's technically termed a form of mild traumatic brain injury, but it's a significant brain injury. A lot of times what's happening is you have the gelatinous brain that's sitting in the hard encasing of the skull, and then you have the brain moving inside the skull cavity, and you've got these tiny axonal structures, these structures that interconnect to the different parts of the brain, and they're getting overstretched and damaged, and what we typically used to think was just a bump on the head, we're actually having some significant damage in the brain.
Yeah, I want to talk about that in a minute, of course. We're talking about, I know what's going on in the NFL with all the lawsuits, and
Sure.
now it's happening in hockey and basketball and soccer and everywhere else. But Dr. Pensivy, you have this little demonstration model that you went. Yes, but it was kind of what Dr. Branch is talking about, right? So what is it?
Well, this is just a simple.
Yeah.
So this is a simple example of what happens. So your brain is the ball inside the water, because your brain actually sits in what's called cerebrospinal fluid.
Right.
And what happens is when you're moving around the brain, if you do it quickly, you can see the ball moves quick and it bangs up against the inside of the container.
Right.
Well, that's exactly what happens with the brain. When you move something quickly, your brain actually hits up against inside the skull, and that's what gives you the concussion. It's called a contre-coup concussion.
Right, but more importantly, you were telling me earlier that even if you protect the brain with the helmets, you're not necessarily protecting against a concussion.
Correct. All the studies are showing that they're getting better and better on helmets, but unfortunately, the helmets that they're designing aren't really protecting the brain. The only way you're going to be able to protect the brain is you'd have to put a pin through it to stop the brain from moving.
From moving?
Yes.
Because even with an additional helmet on top of this,
Correct.
This being the skull, you're going to still move it inside.
That's correct.
So what does a helmet protect against?
Skull fractures, facial lacerations, things like that. So more trauma to the structure, but not really to the brain. There are some studies being done right now with mouth guards. Then they do show that they do help decrease concussions. But again, it's
absorbing the impact before the brain moves. Is that
That's correct.
That way? Yeah.
That's correct. Yeah. So the force is transferred, through the jaw instead of through the skull. But again, you can see it's not going to stop the slushing of the brain moving back and forth in the skull.
So how does one know they had a concussion? As a parent, your kid is always falling, getting tackled or whatever. First you're always getting concerned anytime you get hit in the head, because sometimes you don't know what the damage is. When is the right time to see a doctor?
The right time, we would say, to see a physician, to either have emergency care, certainly if there's any nausea, profuse vomiting, an unrelenting headache, or changes in vision or changes in sensation on either the left or right arm or leg. If we start to see any of those signs, those are usually emergency types of scenarios that we're looking at. But in general, as you said, Ed, there's a lot of times where, and I think this is coming back to the idea that concussions are more significant in the general population than we're giving credit to right now. So what we're seeing is that these individuals, it could be kids falling in a playground, it could be playing sports, it could be doing your normal housework, have a bump in the head, and we'll see dizziness. That's a big predictor for us. Dizziness is probably one of the biggest predictors of a protracted recovery from a concussion. So if we're actually having dizziness after a head injury, that's a huge one. Headaches that are lasting more than maybe just that initial hour or so should be assessed more in detail, because that could be coming from either the brain, could be coming from the neck, could be coming from some biochemical changes, a cascade of effects in the brain as well. So headaches and dizziness are huge. Any visual changes, and I think that's one of the things a lot of our patients that we'll see, initially say, whoa, wait a minute, I was on the sideline and I started seeing double. And certainly, hopefully at that point, the coaches, if not before then, that's what our hope is, that we're able to catch it earlier than that. But if we're starting to see changes in vision, we're able to catch more of the signs of concussion, get in for an evaluation, and actually look at, based on these certain 22 symptoms that we typically associate with concussion, and then evaluate it in better detail.
Well, you know how when you watch a medical show on television and you see somebody get hit in the head, the first thing they'll say is, "Oh, don't go to sleep. Don't lie down and close." Is that true? Right. Is that accurate?
That's one of the biggest myths. I kind of term it whenever I'm doing educating or lecturing. That's one of the big things I'll talk about, particularly in the community, is, okay, what are the big myths? The first one we've sort of hit on is the fact that we need to have head impact to have a concussion. So as Scott was just demonstrating, and we just talked about, you could have a concussion just from a whiplash injury, and that's where the effects of
without hitting your head anywhere.
Without hitting your head anywhere. Just
the forces
force
on your
motion,
neck
and
your
motor
head.
vehicle accident is probably the best example of that. So even if you had a helmet on, that's a perfect example in sports or motor vehicle accidents. That's not going to change the velocity of the head movement.
And seatbelts won't necessarily defend against that either.
Correct. Not as long as the neck and the head are moving.
Right.
So that's a huge one.
But so it's, you don't have to stop somebody from going to sleep after a head injury?
No, that's a big thing. Rest is actually pretty critical for concussion. We're finding that now. So that's another one of the big myths, is that someone will wake them up every hour to make sure that they're still conscious. You want to monitor them through the night, but there's no reason for you to literally wake them up or not allow them to go to sleep, because sleep is actually what's going to help you to recover more quickly.
Is there a diagnostic test that's available to diagnose a concussion?
Right now, what we have, the best information we have from our end is actually looking at how well the eyes are working together. So how well the
So you're doing this thing.
Something like this. Yep, you're tracking eyes. There's technology that's actually coming out in the very near future, some that's already available, that we're able to assess and track eye movement, and that teases us right into what's exactly happening at concussion. MRIs, CTs, they're all great to rule out a more significant head injury, a moderate or severe head injury, but almost always are negative after a head injury or concussion, just because the smaller structures aren't able to be visualized there. So there's the visual component, and then there's balance, which we have in our clinics that we have available, the best research grade equipment to assess your balance. The sensory organization tests, our ability to use our portable force plates to assess your balance, because balance and visual changes are things that you're not going to be able to hide if you had a concussion. Particularly, we're thinking about our athletes that want to get back on the field. Diagnostically, we look at how well their eyes are moving, how well they're balancing in different scenarios. That gives us the best idea of whether or not they've had likely a concussion symptoms.
Right. Now, I know you've been on the show before, Scott, talking about vertigo, for instance, and I was really surprised how quickly you can cure vertigo with exercise.
Correct.
Is that also true with concussions?
And with concussion treatment, the earlier we intervene within safe protocol, we have evidence-based protocols that are being developed right now, particularly with us in physical. That's our goal with the entire nation, to actually intervene, work on these simple exercises that work your eyes, that work on your balance, your inner ear, your vestibular system, quote unquote, and get them to work back to the level that need to. Some of the things that we've noticed in some of the research we've seen is that a lot of these individuals that are going back to sports, A, may still be symptomatic, and B, they haven't really recovered their vision and balance, so they're at risk for another injury, and maybe another concussion, another leg injury, something like that.
So what I'm hearing, essentially, is that when you have a concussion, it's almost the same. Like, look, if you damage your shoulder and a rotator cuff, and you have going for physical therapy to repair it. Essentially, the physical therapy of the brain is not much different. I mean, you have to heal it by doing the right kind of exercises.
Correct, right? and that's what got me really involved with doing concussions was excuse me, I saw there was a correlation between lower extremity injuries and concussions. There was a study done that showed that it was done with about 60 women soccer players, and they had concussions. And those that had concussions had a 50% increase in lower extremity injuries within a year, so they could blow their knee out. So then I took 10 pro baseball, basketball, and NFL players, and we tested them on this machine called a neurocom. Those patients that came in had ACL injuries probably 2 or 3 years prior, and we tested them on the neurocom, and we found that about 70 to 80% still had vestibular dysfunction, meaning that they had a concussion, and 92% of them have a vestibular concussion with that, and it never got fixed. Within 2 weeks, those people all went back to being 100%, with just some simple eye exercises that Dr. Branch gave us.
So you can continue to monitor somebody on the equipment that you have to chart the improvement of a concussion.
That's what's really impressive, is that we have objective computerized data now, not just subjective, oh, I'm feeling better. We're actually showing that the person, an athlete, let's say, wants to play. And most kids want to play the game, right? And they're going to say, I don't have a headache, yet they do.
Or there's a lot of pressure, by it's your profession to get back, in the game. You got a big game coming up. Team wants you there.
Right. And so now we're able to take that person out of that atmosphere, test them objectively, and say, yeah, he's clean. He has no other symptoms. They can't lie about it. It's objective. It's on a test. And we show that to the coach, the family, and then they make that decision. But it's much better than a subjective.
Insurance companies on board with this type of
insurances are becoming on board for sure. On our end, we're seeing that more insurances are covering this type of quantified test because they're understanding that the better information we get at our initial evaluation, the more effectively we're able to treat these individuals and get them back sooner to sports, to work. And limit the impact of the secondary symptoms that they're having. So.
And a lot of the treatment, and we're not talking about medications per se, we're talking about exercises, right? And they're not, we're not talking lifting weights, right? We're talking walking and things like that, right?
And if we think about how our eyes and our inner ear work, they're simple exercises. When I'm going through an evaluation and getting someone started on an exercise program, they're always surprised with how simple these activities are. We're strengthening the eye muscles. We're improving the symmetry between the left and right ear, the vestibular system, as Scott was talking about. They're simple exercises that work with our head-eye coordination to be able to improve how they're working effectively together to improve symptoms and significant benefits with just working in, even within a week, 2 weeks, 4 weeks for some of our patients that have had long-term deficits.
So does the treatment usually involve the type of exercises that you're doing along with medication, or is the medication masking some of the results of the testing?
Yeah, and depending on when we're dealing with vertigo and dizziness, there's a lot of masking of symptoms with some of the medication. Dizziness is probably, and vertigo, vestibular issues from the inner ear are one of the conditions that respond least effective to most medications. So a lot of times it's just masking the symptoms. So there's, in certain scenarios with people that have post-traumatic migraine, there may be a benefit of having some medication, but I believe as we intervene early on, we're able to make more significant change. If we can improve the way the eyes and the head are moving and working together, we're gonna have less headaches, and we're not gonna have to have the reliance on the medication.
So Scott, what are you telling your patients about, the parents of your patients about, a kid, got hit in the head playing football in middle school? I mean, they shouldn't play football, or are they?
No, and again, that's a tough, I would say, a statement to say. I think we just have to be protect, and that's our precautions.
But you have to take more precaution with somebody younger, isn't that correct?
That's correct. There are studies showing that the younger the individual is, and they have a head trauma, the worse that individual will be because of the development that's going on in the brain at that time. Most children that get hurt respond a lot quicker than as we get older in an injury, but in the brain, it's the opposite they're finding. So that's interesting that we have to get this at an earlier age.
So when in doubt, a parent can go and have their child go through these 22 factors you were describing to determine if they do in fact have a concussion.
Yes, and that's one of the things we're hoping with. We're developing a an app that we would be able to assess individuals that parents could have and coaches
At
could
home.
have on its,
Yeah.
at home
Yeah.
and on the sideline at home.
It's called a Sideline app, and we're in the middle of development. Dr. Branch has done a great job in putting that together. So
there's questions you can answer yes or no,
Yes or no.
varying degrees of, 1 to 5, how do you rate this or that, and then come
Kinda
up with a
direct you,
score.
right, and then it will direct
then
you.
it's time to get some medical care once,
Right.
once you hit a certain score.
Correct.
Okay, so for more information, you can reach Dr. Branch at Physical, that's with an F, and Dr. Pensivy at Sports. What's your
yeah,
name?
physical sports.
Physical Sports. Right. So, or else you can go to our website. We have links. So we'll see you next week. Hope we've given you some good information.
All right, great.